My name is Margaret McKenna and I'm the Patient Co-ordination Centre Manager at the Golden Jubilee. In the PCC, we're responsible for scheduling all the outpatient appointments, and that includes your consultations and your pre-assessment and all your COVID appointments. We're also responsible for scheduling all the admissions to the Golden Jubilee and all your theatre scheduling for all the specialties. So when COVID hit, all elective services across the country were suspended, and that threw up new challenges for us within the Golden Jubilee. A lot of the staff weren't able to work from home, so we had to try and set up different shift patterns to get them in. Our staff then had to contact all the patients who had a date for surgery, and we had to inform them that that was actually postponed. We then had to inform all the patients on our waiting lists. There was our outpatient waiting list, our inpatient waiting list, and we had to phone every single patient and inform them that all planned elective surgery had been postponed. And what was probably more upsetting for a lot of the patients was that we couldn't give them any time frame on that. We didn't know when it was going to end, and I think that was more upsetting for a lot of patients than anything else. They did understand why we were cancelling it, but they wanted something to work towards and we couldn't give them that. So at the start, the Patient Co-ordination Centre were fielding a really high number of calls from patients who were obviously quite anxious what was going to happen to them, and did they see any timelines when they might get their surgery, when we might restart. So as well as continuing with the urgent heart and lung services and scheduling of all the urgent cases, we also took on additional urgent cancer cases from other health boards, and that helped us to play our part within NHS Scotland.
During that time, the staff worked really hard. However, we did have to put social distancing measures in place, which meant that we had something like 36 seats out there, but actually we could only then accommodate something like 11. So we initially had to introduce a rota, and that involved maybe half-day shifts, so some staff were coming in the morning, some were coming in the afternoon. Then we decided that was maybe appropriate, so we done like all-day shifts, so somebody would come in on a Monday, then someone else on a Tuesday, Wednesday, Thursday, so that we had the kind of staff rotating. So we listened to all the staff's challenges and what they had around between their kind of home life, their children's life, that kind of things, because schools, as we all know, had closed down. We had some people who had medical conditions. We had to send them home right away to isolate at home. We took all this on board, and at that we came up with a kind of idea where we would put them onto a rota, a shift pattern, taking into account that some people had some help with their childcare and some people didn't. We tried to make this as fairly as possible for the staff. We eventually kind of got there, and we got into a flow and a way of working that made a happy working life for everybody. Come June time, we started up the elective work again. Again, we were still kind of trying to do the social distancing, so this was causing quite a number of challenges around how can we keep the numbers going, how can we keep the staff as safe as possible. So we had to look at the desk situation. We were using some desk space over in another level. We were coordinating the staff along there, which was quite good because we had all the systems in place, and NetCall being one of them. NetCall's our telephone system for the patients to phone in. So you can actually work anywhere in the hospital and take these calls. You don't actually need to primarily be at your desk. You can actually take them at home if you're working from home, which is a good thing. You can route the calls to the person's mobile, and they can take the calls via their mobile at home. We then were looking at e-health solutions as to how we could get more desk space in the environment that we've got, which we managed to do. We are now working, some of us are working from home 1 day a week. Again, it's got its challenges, but we're managing to make it work for everybody. The staff member who had a medical condition, he had came back to work when the restrictions were lifted, but unfortunately due to the second spike we've had to then send him back home to work from home. Now that we've restarted the elective work, we are the first point of contact for making the calls to the patients to invite them in for either an outpatient or inpatient appointment. At that point, the patients maybe have some anxiety levels around coming into the hospital, making sure that they're maybe a wee bit wary because it is a hospital environment. However, we reassure the patients, we empathise with them, and we just try and encourage them as much as we possibly can to come to these appointments, because it is a good news story that we're actually able to do this work again. You know, there was such a long time where everything was on hold. Majority of patients are delighted to come in, especially now that we've got the COVID test centre on site, which is a positive thing for the patients. They can come, they can get tested, they know that they're coming into an environment where it's a COVID light site. It's also encouraging for the staff because they kind of hear the patients' woes, they can kind of talk them through it, and actually when you hear them on the phone you think, you know, they've done a really good job. The staff at the end of the day are quite happy that they've got their clinics filled, everything's getting utilised as best as possible. The staff have absolutely rose to the challenge 100%. They've done an amazing job given the challenges, given the current situations, given their own feelings, given their own expectations to things. They've done an absolutely amazing job to keep the services running for the NHS, in particular the Golden Jubilee, and you couldn't praise them enough for the work that they actually do.
I think everybody had their own separate challenges within their own families, their own coming to work. Everybody, it was a wee bit scary for everybody. I think the workplace has been really helpful. They've helped everybody in any way that they can. They've reassured us that our distances are remaining at 2 metres. So I think in general although it's been a really scary and tough time, we have managed to get through it and be a stronger team. It's helped morale. It might be low in some places, but coming to work, it's knowing that you're in an organisation that's doing everything that they can to help us. It has relieved a lot of the pressures and fears that the teams have been maybe under or are feeling, just with the not knowing what's going to happen next. But I think it's been a tough time for everybody.